Hi, I'm Stephanie, the PT with the Note Ninjas, and together with Nicole, we help other therapists with treatment planning and documentation. And we are the creators of the Note Ninja membership. So today, we want to talk of an activity using cards. Now, our patients love activities using cards, our adult patients and our pediatric patients. And I'm not sure why, but it always helps with engagement and motivation. And there are just so many things we can do with cards for balance, for strengthening, for coordination, for motor planning. I mean, we don't need to buy this expensive equipment. We can seriously use a deck of cards and work on so many skills that lead our patients to their goals. So let's watch a short video of just one activity we can do with cards, and then we'll explain the different activities we could possibly do and how we would document it to show our skill. So there's a child doing it. However, you can also do this with an adult. So let's watch the video. Okay, so the kid had a bunch of cards in front in like a half circle, and they were standing in the center of it. So to begin, we could just have the patient go in a circle, maybe all using their right leg, touching the cards, and all the left. Maybe we could have the right leg just doing the ones on the right, the left one doing the ones on the left. And then we can start modifying, which shows our skill. What are we doing? What are we changing? How are we progressing? Maybe we are just calling out right leg 3, right leg 5, left leg 6, to whatever numbers we have around. And we can put the numbers maybe like a clock. That might make it easier. Or we can scatter them. Or maybe we're going to do red or black. Truthfully, these are all different upgrades and different ways our patient can do it. And if we're documenting, patient went from black and white to numbers, that's increasing what they have to do. It's increasing the cognitive task, which is fantastic and a progression. So we can do that. We can increase the speed. Maybe we'll call it out faster or call it out slower. We could put the patient on an unstable surface. Maybe they're standing on a foam pad or a Bosu or a Dynadisc. Maybe we are doing a full circle. Now they have to reach backwards. Maybe they're staying on a tiptoe and reaching with their other leg. That might be a little hard, but maybe somebody can do it. There are just so many things we can do with cards. And this is just one activity with cards. Put them in a half a circle. There's so many more. But as you saw, that's the progression. Starting the right leg on the right, the left leg on the left, alternating to the right leg doing all the cards, the left leg doing all, then adding just a sporadic variety into what you're calling, then maybe randomly calling the right or the left a different number, increasing the speed, adding an unstable surface. And it's just so many, I'm sure you can even think of more options than that. And then besides that, the documentation. You would put in your notes, patient progressing with, if you're working on the balance, coordination, motor planning, whatever it is that this activity is supposed to be focusing on for that patient, progressed to increasing the speed from a beat of 5 to 10, whatever it is, or to adding varying degrees. Whatever it is you did, that shows the progression. That's a skill. That's why the patient had to come to therapy. And then also, what did you do? Maybe you needed to give them verbal cues to for posture. Maybe you had to do tactile cues when they were reaching to the side to get those abductors working. Maybe you had to give manual assist at the core for balance. Whatever it is that you had to do, make sure you document that too. Because what activity did it work on? How did you progress? And what did you do that a layperson or a caregiver might not know how to do? So again, get those cards. So many activities. We would love to hear what activities you like to do with cards. Let us know in the comments. And make sure to follow us at the Note Ninjas for more treatment ideas and documentation tips.